Hello, my name is Mike Miller, Dr. Mike Miller. I'm Director of Fellowship Training at American Health Network for our Foot and Ankle Reconstructive Surgical Program. We established the program 10 years ago in an opportunity to give back to our profession. We started out with a group of directors at AGEN, Dr. Blackledge and myself, 15 years ago. And with our training, our fellowship training, and what type of procedures we did, we grew our group into a conglomerate of about 8 attendings. And what we looked at is we have all these good surgical cases that no one was benefiting from. So the fellowship was established again in an effort to give back to our profession for surgical training. Initially, one would think we could start a residency in the Indianapolis area, but what happens is we're all geographically spread out around the Indianapolis area, so we weren't working out of one solid institution. So we came up with the idea to start the fellowship, and this started back around 2001, I believe. Our first fellow was actually a trauma surgeon from Austria who came over who wanted to learn foot and ankle surgery, and we enjoyed that opportunity so much, just the teaching and giving back, that we rolled it into a full-time position. And actually, since we have one of the fellowships that's been established, actually one of the longest ones in the country, that has grown to be one of the few fellowships to now, there's about 20 fellowships that are recognized through the American College of Foot and Ankle Surgeons, and ours being one. Our fellowship, the way as the director, we put this fellowship together to be fellow first. What we wanted is our fellow to have the experience that perhaps we didn't have. The fellowship is a fellow first driven program, meaning that you get out of what you put into it. There's a high patient load, volume load of surgeries. Last year the fellow did over 700 procedures, 700 surgeries on patients, multiple procedures obviously. What's nice about our group is we have a diverse amount of attendings, and everyone has subspecialized training. Myself, I went to residency at Loyola University Medical Center and Department of Orthopedic Surgery back in the day. I did a fellowship under the auspices of Dr. Sigvard Hansen out at Harborview Medical Center, University of Washington Medical Center back in 1995. When I came back, worked with a group out of Methodist, and then joined AHN, which is a large multi-specialty group, and again with Dr. Blackledge, started our group and grown it into what it is today. As far as the difference in the training, my fellowship personally was more orthopedic trauma related, but what we wanted to do is give back again to the profession, mostly in a reconstructive manner. There's opportunity for trauma, plastic surgery, really the connections that we have in Indianapolis. There's a variety of opportunities for our fellows, but most of them come in wanting to learn foot and ankle reconstructive surgical procedures, which is what we do the majority of. As I mentioned, we have subspecialized training. I do quite a bit of pediatric, sports medicine, again reconstructive surgery. Some of the guys in the group do specialized nerve surgery. We have one partner, Dr. Winters, who does diabetic limb salvage. So the advantage of that is the fellow will rotate with these attendings every week and kind of cherry picking essentially what cases they want. As I mentioned, the program is a fellow first program, so over the 10 years we've had fellows that just were in the OR every single day, and that's what they wanted to get out of it. We've had fellows that were highly engaged in research and wanted to publish as much as they could. And I've had some fellows, a few, not many, that wanted to spend more time in clinic and get some experience in that area. So again, the fellowship can be molded in any manner that the fellow wants. As far as other opportunities, in the Indianapolis area, like I mentioned, there's opportunity to do outside rotations. We've had fellows go over to Europe and do AO fellowships during their tenure and matriculation through our program. So as a consensus here amongst our group, I wanted to start out as the director and just introduce you to our fellowship program. We're going to have some more videos from some of the other attendings kind of expounding upon their thoughts about the program as well. I really think that the amount of volume that is seen and the type of pathology that we do in revisional surgery, the fellow can actually get about a 10-year experience in 1 year as far as surgical training with our program, and I think that's what differentiates our program from a lot of other programs in the country. We don't have our fellows on call at the emergency room or really any after-hours work. It's pretty much a country club fellowship in that aspect. But again, if you are interested in our program, we do expect hard work and dedication, and publishing a couple papers a year to keep our fellowship growing and the reputation expanding. So thank you very much.